what are
Yeah.
these top complex issues? You mentioned the fermented food. I think that's a really good point here. What's going on there? And what are the other things that you're seeing to maybe let's shed light on it and let people know they're not alone?
Yeah, and the question is, are we seeing more of it because there is more of it, or are we seeing more of it because we're finally giving a voice to people who were written off for years? Maybe went to the doctor complaining of bloating, and they were just told, yeah, you just gotta kind of live with it. For example, SIBO. I mean, that's become such a big diagnosis in the last couple of years. But is it that SIBO didn't exist before then, or we just weren't looking for it? We weren't checking for it. We weren't doing breath tests. That certainly wasn't something that was on the radar 20 plus years ago when I was in medical school. And yet, SIBO is the underlying reason or cause for at least 60 to 70% of people with IBS might have underlying SIBO. And why are we seeing so many gut issues in general? I mean, I think we have to look at how many people are getting antibiotic prescriptions, millions per year. Probably to the tune of like 40 some million antibiotic prescriptions that are written that weren't actually necessary every year for viral infections. So we're doing a lot of things between antibiotics, overuse of hand sanitizers, using antibacterial soaps, which have been shown to cause changes in the gut microbiome that are not favorable, that and along with just eating too many processed foods, pesticides in our food, glyphosate that contaminates the not only GMO crops, but also wheat, that we are basically living in an onslaught like a landmine for our guts.